Hello, hi, I'm Dr. Nina. I'm a board certified radiologist, breast cancer specialist. It's about 4:10 here in New York City. Thank you for joining me today. I just wanted to share some interesting information. So again, I'm Dr. Nina, board certified radiologist, breast cancer specialist. I help busy individuals, those who have a hectic schedule, demanding careers, juggling numerous obligations, learn to take better care of themselves while they continue to take on everything else in their life. Today we'll be talking about an interesting topic that we hear a lot in the news. It's very important for women to understand exactly what that means, and that's dense breast tissue. The question is, what does it mean for you? What does it mean for your mammogram? So breasts are composed of glands and they're composed of fat. Now, if you have a lot of glands and you have very little fat, your breast tissue is described as dense. If you have a very few glands and you have a lot of fat, then your breast tissue is described as fatty. Now, dense breasts are common, they're normal. If you were to look at all women who are age 40 and over, about 40% would have dense breast tissue. And also, dense breasts are more common in women before menopause, and as women age, the breast tissue begins to become more fatty. Now, what does density mean? What does it matter? So each time you have a mammogram, your radiologist will check the density for two reasons. So the first reason why they will check the density is that dense breasts have a higher likelihood of developing breast cancer. The second reason is also because that breast cancers dense breasts can make it more difficult to detect a breast cancer on your mammogram. For this reason, some states now require that radiologists give you your breast density on your mammogram report. Now, if you find out if you have dense breasts, what does that mean? What should you be doing? Are there additional options for your breast cancer screening? Now, because we know, as we were just talking about, that dense breasts can hide cancers, women with dense breasts may benefit from additional screening. That additional screening test, when combined with a mammogram, can help to detect breast cancers when they're smaller. So one additional screening that some women may choose is tomosynthesis. The full name is a digital breast tomosynthesis or a 3D mammogram. So a standard mammogram is a two-dimensional. So you're looking at the breast tissue in sort of this position, you're looking at the breast tissue in this position. With the 3D mammogram, slices are actually taken and you can look in between the overlying breast tissue. This may help radiologists to find a cancer that may not be found just on the standard images. 3D mammogram also has another benefit. Sometimes after a mammogram, women may be asked to come back for additional pictures to help the radiologist make certain that something they're seeing is not a breast cancer. With 3D mammogram, the chances of being called back for additional pictures is less. Now, if you would look at the radiation dose for a 3D mammogram compared to a standard mammogram, they're the same. In some instances, women may get a standard mammogram and a 3D mammogram, which will double the radiation dose, but still is within safe limits. The good news also is that there's new software being developed that will double it. That will halve the radiation dose for 3D mammograms. Now, so in addition to a 3D mammogram, an additional option or a screening test would be breast ultrasound. Now, breast ultrasound also should be performed in combination with a mammogram. And it has a number of benefits. When the two are combined together, they can help to find more breast cancers that may not be seen just on a mammogram alone. Also, for breast ultrasound, it uses sound wave technology, so it does not require radiation. There is no additional radiation dose to the breast tissue. One thing about breast ultrasound is that also, when it's combined with mammogram, you may be called back for more additional images or more additional pictures than you would be just for the standard mammogram alone. And the other thing is that there's a chance for more biopsies to happen that turn out not to be cancer. Now, the third additional screening test that could be considered is an MRI. Now, sometimes there's women who have a very high risk of breast cancer, like those who have a breast cancer gene, or in women who have had radiation to their chest for lymphoma, where a breast MRI would be indicated. And this should be done regardless of breast density, because breast MRI is the best test that we have in finding a breast cancer. And if a MRI is performed, then there's no need to perform the screening breast ultrasound. Now, there's a lot of research going on, which is good, that's helping to make breast MRI faster and cheaper while still being able to find a breast cancer if present. But just like with any new technology, breast MRI isn't perfect though. It can show abnormalities that may require additional testing, some that may require biopsy, that may not turn out to be cancer. Another positive thing about breast MRI is that, similar to ultrasound, an MRI does not require radiation. So, one question that a lot of women, a lot of patients may ask is that, can they just have a breast ultrasound alone or a breast MRI alone? So while these tests, these exams are very beneficial, the best benefit is when they're combined with a screening mammogram. There may be types of breast cancers that can be seen on a mammogram that may not necessarily be detected or seen on ultrasound or on the MRI exam. So, just in summary, dense breasts, they're normal, they're common. Because women who have dense breasts may have a greater chance, a likelihood of developing breast cancer, and because it can make a breast cancer harder to find on a mammogram, they may choose to have additional screening. Additional tests could include a 3D mammogram, breast ultrasound, or a breast MRI. Now, I know this is a lot of information, and if you have any questions regarding your breast density, regarding what additional screening tests may be right for you, remember that your doctor is there to help you and to answer any of your questions. So again, this is Dr. Nina. I'm a board-certified radiologist, breast cancer specialist. I help busy professionals, busy people who have hectic schedules, demanding careers, juggling numerous obligations, learn to take better care of themselves while they continue to take on the world. For more helpful tips and information, you can please follow me on Twitter, Dr. Nina Watson, that's DrNinaWatson. Bye.